So I want to walk you through a low oblique sit exercise that we commonly use with patients. And I think it's a little bit better option for a lot of people outside of maybe the traditional hip swivel, hip switches, whatever you want to call it, this 90-90 hip opener. I think it really kind of hits that a little bit better and kind of gets the lower back involved. And I have found to get a little bit better dynamic hip stretch or hip mobilization than maybe like a figure four or some more of the static stretching. So your setup position is like this. So it kind of looks a little bit like that hip swivel. One of the differences is like this back leg. We'll talk about it later, but we don't want to get it into too much hip extension because we'll start to kind of feel that in our lower back. So in this position, I'm treating or addressing kind of my left hip or the downside hip. You'll kind of feel it if you pull your chest forward and kind of keep that lower back in a good neutral position. You'll start to feel that stretch. So maybe that's kind of step one, nice and easy, using kind of hand support where you need it. I've even added kind of these functional triplanar reaches where you would kind of just go like that. So that's kind of a little bit of a pigeon stretch. And then from there, we're actually going to rotate our spine around it. So as I rotate my torso, this hip is in closed chains, right? This knee is driving into the ground. My goal is to kind of start in full hand support, keep a nice, good, neutral lower back. And then as we get more comfortable, we can kind of come down on our elbows. So here, I just oftentimes just have patients kind of breathe in this position, nice, deep belly breath to kind of start to own it and start to feel it in the right places. And the place to feel it isn't in the trail hip. That should be pretty quiet. You shouldn't really feel it in that kind of that right lower back in the setup. You're going to feel it in the downside hip. So in this position, good chin position, focus on spinal elongation. And then to kind of amp this up a little bit, we're going to drive our downside knee, the outside of our left knee in this situation, down into the ground. You're just going to kind of hold that for 3 to 5 seconds and then slowly back off that. And what you'll feel is like a really good deep hip stretch, hip activation. It's kind of taking those fibers of your glute and your posterior hip and almost lengthening them, which a lot of stretching and activation struggles to kind of hit this, and this is why it's so valuable. So you kind of push that in, you kind of feel that, and then to make it harder, you're just going to kind of hover that downside hip a little bit more. Okay, you're going to let this right leg kind of hang out. Try not to use it too much. You're really trying to focus on that downside hip. Hold for 3 to 5, and then slowly lowered. The underrated aspect of this exercise is that slow lowering. So as it gets a little bit more advanced, you can really kind of get that hip high and then focus on fighting the down. So sometimes when patients are here, I'll actually give them a little bit of doctor overpressure. Like I'm going to try to push them down into the floor and have them slowly resist and then slowly down. So you can kind of make this harder. You come all the way up here and then slowly back down. It's based off a developmental kinesiology position called low oblique sit. You'll see young kids playing like this, or they'll transition from here to a crawling pattern. So we kind of hack that pre-programmed crawling motion and are able to kind of activate it. So I'll show you a modification where you can use a band over here on the rig to actually kind of pull you in this direction. I'm actually going to switch it up. So if we do it on the other side and we kind of take these furniture sliders, this is something I like to use, rotational athletes, golfers, throwers, to make it a little bit more active, spinal elongation. So same setup, 90-90 here, downside hip is working, rotate around that, slide out with these furniture sliders, good deep belly breath, and then kind of come back up. So it's a little bit more of an active mobility, underrated in my opinion, for anybody that's suffering kind of lower back, hip complaint, rotational athlete, active adult. And you'll see what I'm talking about when you get into this position, is you'll feel it in just such a different way than maybe you felt with a hip swivel, elevated pigeon, pigeon pose, figure four, all those classic hip stretches. So add in those furniture sliders, kind of focus on that spinal elongation. And then your focus here is the downside hip, knee down into the floor. So something else we can do, we kind of set up by or anchor it to the rig. So I have a, 1/2 inch, 3/4 inch band here. we're going to grab it with our left hand, right? Because in the real world, in a crawling motion, that downside arm will kind of rotate there. So this is considered the open chain arm. Same setup here. You want a decent amount of tension there. You can be on your hand. I kind of like to be on the elbow. You're going to go here, push that in, kind of come up, and then slowly lower. So I kind of feel like I need a little bit more tension, so I'm going to back up. Good, push in, up, and then slowly lower. I think this kind of gets into that left low back here, get a good stretch. Downside hip drives, elbow drives, and then slowly back. That backside hip, left leg in this case, is just kind of hanging out. You notice I kind of go up onto my toe. I don't necessarily have to. It can kind of hover and then back down. So I call that the low oblique sit progression, regression. There's a bunch of different ones to try out that we use with patients commonly. Anybody suffering from lower back hip, it's a way to kind of get those hips moving in a dynamic, active stretch, and then kind of make sure that lower back is in the right position, belly breathing and supported.